TrueD does is it's a machine that you reel into a room and it automatically kills every pathogen on every exposed surface in the room. And it does so automatically. You don't have to do any measurements or anything like that. It measures everything for you and it doses the room appropriately. We're asked very commonly, how does this machine do its job and how do you even know it's done its job? We employ a wavelength of light called UVC. It's not ultraviolet like you think of in tanning beds and things like that too. You actually don't see it in nature outside unless you go to outer space. The ozone layer filters it out. So the bacteria have never actually seen it. So we generate massive doses of that wavelength. And as we do it, we see what's being reflected from the room back to the unit. So we can actually measure even what's going into primary shadowed areas to know that it's killed everything. But the primary dosing is, the primary mechanism of kill is by UVC. It's called ultraviolet C-band. The heart of the machine is a sensor array. Using UVC technology to kill bacteria is not new. What's new is the heart of the machine, which is that sensor array that measures what's being reflected back to the unit from the walls and ceilings and floors. So the best way to think about what it does is it illuminates the walls and ceilings and floor and measures what's coming off of them, and it's that dosing that's used to determine when it's finished killing everything. So even things in relative shadow, it kills, and it does so automatically. There are no known resistances to this technology. It kills bacteria or any other microorganism by uncoupling its DNA bonds. So it gives you double-stranded DNA breaks. That is universally fatal in every microorganism. So right now there are no resistances to it. Nationwide, by far and away the most common use of the device is in healthcare facilities. We're seeing it used in quite a few hospitals. There's a hospital system in Macon, for instance, has done it. In Cleveland, there's some in Atlanta, Washington, D.C., Los Angeles, really kind of all over the country. It's being used, again, primarily in healthcare facilities. What we think, however, there are applications that go outside of the healthcare community, such as daycare centers and nursing homes and even veterinarians' offices. Some of the most common users in this area are actually dental offices and oral surgeons' offices and that kind of thing. But practically anywhere we have a susceptible population coming together in one space, we think it's worthwhile decontaminating that space afterwards to reduce infections between people that come there. That can be airports, it can be public bathrooms, it can be schools. The Washington, D.C. school system engaged a machine for a while to manage a specific problem that they had. Sometimes we found that even meat processing plants and grocery stores have had problems with outbreaks of organisms. And they can call TrueD Tech, and TrueD Tech can come and manage it for them. One use that most people don't think about, for instance, is a lot of us now have family members that are sick at home, sometimes chronically ill under cancer therapy or things like that. And sometimes when that person needs to leave the home, they died or they got moved to another facility, often those patients are contaminated with highly resistant bacteria that are known. We know that they carry them, and we feel like there's applications to come into the house of someone who's had a loved one in that condition and use the machine to decontaminate where they were. But again, practically any place you put large groups together that can exchange organisms particularly during cold and flu seasons, we think the device has some applications.